Good afternoon and welcome to Geisel's live Conversations That Matter speaker series. Today, we will be discussing caring for Muslim patients during Ramadan. The Islamic holy month of Ramadan actually began on March 22nd and will end on April 21st. So coming up, we will hear from a remarkable group of panelists. But before that, let's start with me. I'm Dr. Lisa McBride, Associate Dean for Diversity, Equity, Inclusion, and as we like to say in my office, the B, Belonging, at the Geisel School of Medicine. And I will be joined by my co-host, who will introduce our panelists today, Abdul Rahman Latif. Chaplain Latif is a Muslim chaplain at an associate director at our Tuck Center of Spiritual and Ethical Living at Dartmouth College. Good afternoon, Chaplain Latif. How are you today?
I'm great, Dr. McBride. Thank you for having me. It's really a pleasure to be here, and it's wonderful to see the Geisel and Dartmouth Health community coming together to talk about this very critical and important issue. I'd like to introduce our esteemed panelists. First, we have Dr. Jibran Ahmed, a physician at Dartmouth Hitchcock Medical Center, a trained neuroradiologist and assistant professor of radiology at the Geisel School of Medicine, where he's also a faculty advisor to the Geisel Muslim Student Association. We also have Dr. Amal Al-Ibrahim, the first-year OBGYN resident at Dartmouth Hitchcock Medical Center. She's a graduate of Howard University Medical School and has a background in geophysics as well.
Thanks for having me. Pleasure to be here.
In addition, we have some of our medical students. Fatima Haider, a fourth-year medical student at the Geisel School of Medicine, who recently matched in internal medicine and pediatrics at University of Michigan. Congratulations. She has done extensive work for the Afghan refugee population in New Hampshire.
Thank you so much for that kind introduction. So excited to be here and doing this.
And finally, we have Saf Ansari, a fourth-year medical student at Geisel School of Medicine and a dual degree MPA student at Tuck, who has some very interesting projects always in progress.
Thanks for having me, Abdul.
Well, thank you so much, Chaplain Latif, for introducing our amazing panelists today. And for you, our audience, if you would like to be part of today's conversation, it is very simple. All you have to do is place your question in the Q&A section, which is at the bottom of your screen, and we will do our best to get some answers from our esteemed panelists. So Chaplain Latif, let's just get right into it and start off with you explaining what is Ramadan. I think our audience would really like to know.
Thank you for that question. So Muslims, for those that don't know, are a monotheistic community following the tradition of the Prophet Muhammad, Abraham, the many biblical prophets. One of the types of devotions Muslims do to obey the divine commandment, to create a spiritual environment and really connect with the divine, is to fast during the month of Ramadan. Ramadan is a month in the lunar calendar. It changes about 10 days every year. And during this course of 29 to 30 days, Muslims fast from dawn to dusk. No eating, no drinking, yes, not even water. Ramadan entails more than just fasting, though. It also entails removing oneself from sinful or ill behaviors, fasting from anger or gossip or lying, for example, and really attempting to fast from anything that takes you away from connecting with the divine. Fasting, however, is a big component of this month of Ramadan, a way of developing spiritual discipline and reminding oneself that you can do more and give up more for the sake of God even after the month is over. There are, however, some exemptions to fasting, and fasting is not the only way to connect to the divine during this month. But we have our esteemed panelists to help us understand what those exemptions are. And with that, I would like to jump into our first question for all of our panelists. Why is it clinically important to know about Ramadan and fasting?
Yeah, so I can go first with this question. I think the first important point to know about fasting and how it affects someone's health is that they're abstaining from food for a significant portion of the day. So that has implications for how one's diet changes. People are also oftentimes staying up late in the evening for prayer and waking up very early in the morning to eat before dawn. So it impacts their sleep cycles as well. And then alongside abstaining from food and drink, many Muslims will also abstain from taking medication while they're fasting. So the timing of medication and all the things that come with that are also impacted. So these are some very important points to keep in mind as far as understanding why it's good to know if a patient is fasting or not.
And sort of going off of that, I would also add that, knowledge is power. And we hope that this knowledge of Ramadan would empower you to help your patients. And personally, I believe it's our role within the scope of our training and comfort, of course, to advise on Ramadan safety, which includes the considerations that Saif just mentioned, considerations for hydration, changes in sleep pattern, changes in medication dosage or frequency, work or school accommodations, and for some patients, whether they should be fasting at all, but more on that later.
And to continue off of that as well, I think for all of us, the community of providers or community members, I think knowing clinically about Ramadan and our scope is to deliver human-centered, personalized care and to create safe spaces in our clinics and offices where our patients feel free to share with us that that's part of their year, part of their day, and part of what they identify with and what brings them joy. I think big part of what I really enjoyed about being part of this conversation is truly to, like, big things to take away from this is our goal eventually is to get to know each other as humans and as providers and patients, and to create safe spaces where patients are able to be their true selves.
Thank you for inviting me to this conversation that matters. I missed my cue, my apologies. I'd like to address this in a slightly more systematic approach. It's wonderful to have information about Ramadan and fasting, but on this, from a clinical standpoint, providers who are seeing patients, unless they have a deeper understanding of what Ramadan is and what the fasting entails, it's very difficult to truly provide patient-centered care where you can develop a rapport with the patient. So let me start off with Ramadan. What's important to know about Ramadan? Number one, that it even exists, right? So if we don't know that it exists, we can be prepared to see patients who are undergoing this act of worship, the fasting, during the month. And so just knowing that it exists is vital. There's 2 billion Muslims in the world, approximately, almost. And although the vast majority concentrated in Muslim majority countries, or in minority countries where they're aggregated in specific populations, you'll be surprised to find Muslims all across the world, places you wouldn't even expect. And so to encounter a patient who's fasting or will be fasting is not unexpected. The second thing is to even acknowledge that the Ramadan exists. I'll prelude this question or segue into this aspect with an anecdote. I did my internship at a specific institution, and at Ramadan time, the medical center put up at the main entrance a large plexiglass statuette placard type of welcome that had a Ramadan greeting on there. And so I walked into the medical center and it was absolutely wonderful to see it, boosted my morale. But more so, it served as a reminder to the clinicians that this time of year has come, right? This time of year has come, and that you need to be a bit more mindful that you'll be seeing patients who are potentially fasting. But even more so than that, it provided a solace to the patients who were entering to know that I'm entering an institution where I'm going to be cared for by people who have a baseline knowledge that this month exists and what it entails. So it's really important to even acknowledge it. So number one, that it exists, and number two, to even acknowledge it. The third point I want to talk about Ramadan is, as Chaplain Latif mentioned, the Ramadan is based on the lunar year. And so what that means that it's 10 to 11 days shorter than the calendar year that you and I are normally used to. And so every year, Ramadan comes earlier in the calendar year in relation to the calendar year by about 10 to 11 days. So Ramadan, as Dr. McBride mentioned, this year started March 22nd. Next year, it'll start the beginning of March. The year after that, it'll be the end of February. And so what this implies is that Ramadan can be missed because it's not something in our calendars that recurs in relation to the calendars that we know, but also has implications that Ramadan doesn't have a season, right? It can aggregate over a number of years in a particular season, i.e. a few years ago it was aggregated in the summer, but as the years go on, now we're in the springtime, and in a few years, it'll be in the winter time. And so what that implies is that Ramadan, the daytime fasting hours where these patients are fasting will vary over a number of years. And the implications of that are the challenges you may find in the hot, long days of summer may not be that much of a challenge in the winter time, although there still needs to be taken into consideration. So those are the clinical aspects of Ramadan. As far as fasting goes, we're not offering specific medical advice nor treatment plans. We're offering an approach on how to care for patients who are fasting and to develop a rapport with the patients. And so we need to understand what the mindset is, why they're fasting, what will prevent them from potentially not accepting medical advice. What is going on in their mindset, and what is their daily routine, generally speaking, during the day that's going to offset any potential conditions or medication regimens, et cetera, et cetera. So the first thing to know is that unfortunately, the month of Ramadan is associated with fasting, i.e. refraining from food and water. And the actual Arabic word for that we're supposed to be undergoing is sawm, and it actually doesn't mean fasting. It actually means to refrain. As with any act in Islam, any act that Muslims do, they're all spiritual acts to bring us into a spiritual state that's entered into by a physical act, or in the case of fasting, refraining from a physical act. And so the fasting is just a baseline entrance. Refraining from the food is a baseline entrance into the actual refraining. And this refraining has to do with refraining yourself from any boorish inclinations, right? From any lack of comportment, et cetera, et cetera. And I'll talk about that in just a moment. I think it's important to harp on this just a little bit because there's a spiritual, psycho-spiritual aspect of this that may get lost. And I want to harp on that just a little bit. Why are Muslims fasting? And my panelists, feel free to jump in any moment if you want, if you'd like to add in. Why are we fasting? So as Chaplain Latif mentioned, the Islamic faith is based on the Quran, right? And so there's a series of verses in the Quran that talk about fasting and Ramadan, and why we fast, what's the goal of fasting, what are the benefits of fasting, what's the purpose of fasting. This will have implications if you bear with me. And there are 4 different questions to ask. Why do we fast? The answer is that the Quran tells us Ramadan is the month of the Quran, and that when you witness this month, then fast it. So we're told in the Quran to fast it. What's the goal of fasting? The goal of fasting is the word that's used in one of the verses, taqwa, which is, as I alluded to, has to do with comportment. Commonly translated as God consciousness, to be aware of God at all times, right? But it has to do more with composing yourself in your public and private life, whether you're alone or whether you're around people, in an honorable, dignified, noble manner. It has to do with comportment. And so that's a means to the purpose of fasting. What actually is the purpose of fasting? And the purpose of fasting is that we're told in one of the verses is to, as Chaplain Latif mentioned, to develop a divine nearness, right? It says that the verse states, roughly translated, when my beloved worshippers of creation ask you about me, then I am near. I respond to the call of the caller who calls out to me, right? And so this is when we talk about patients who are potentially doing this fast to the detriment of their health, there's a higher mindset there, that they're not considering themselves, they're considering their relationship with the one who ordained the fast, right? And so that's really important to know and understand, that although Islamically health and in maintaining your safety is priority, there will be patients who will sacrifice their health and their safety in order to develop this connection, because there's a spiritual connection there. So there's and so what are the benefits of fasting? The benefits of fasting, many, right? Of the few is that it's very communal, right? It's a very communal time where we eat together when we break our fast, we pray together. And so there's a psychosocial aspect to this, in that patients who are sick and not participating in the fast can feel left out, right? They may feel bad not developing this relationship, but also they're losing out on the communal aspect, right? And mental illness and loneliness is a huge factor. And I don't know how prevalent it is, but I know anecdotally this is a problem, absolutely. So it's a problem. And so if patients are not involved in this communal activity, they can feel lonely. What is the routine? And let me finish off with this. The routine of a typical day, generally speaking, is that we start off with a pre-dawn meal before the sun rises. Then we refrain from the food and water and smoking, etc., throughout the day, where we're working, going on with our life, family, and any acts of worship, resting, etc. And the iftar, right? We break our fast, and at night, we stand in prayer and contemplate on the Quran. And this is a long day that people do and disrupts sleep patterns, as Saif and Fatima mentioned. And that's what I wanted to know about Ramadan and fasting. Set the setting for our follow-up questions. Thank you.
Thank you so much for that insightful answer. And for those that, again, would like more information, if you go to the Q&A section button, you will see that my esteemed panelists have left links for all of you to have as a resource later. Chaplain Latif,
Yes,
how about
thank
we
you.
jump into another question?
Absolutely. Thank you all again for that wonderful and very comprehensive series of answers. This question is for the clinicians on our panel, Doctors Al-Ibrahim and Ahmed. Should patients seek medical advice before fasting for Ramadan? Are there any pre-Ramadan or even post-Ramadan considerations?
Thank you, Chaplain Latif. Short answer is yes. We'd love to hear from everybody. I'd like to preface this with saying that in Islam, I think we might have mentioned this, but I want to reiterate it, is that anybody who, if their health does not enable them, so anybody who is sick, there are so many exceptions to fasting, is what I wanted to say, is being in having health issues is one of them, having traveling, or for women, pregnancy, breastfeeding, if anybody is fearing for their health in any circumstance, they are exempt from fasting. But some studies that were done actually just recently showed that a lot of patients refrain from sharing that they're still fasting, even though the religious and the medical recommendations for them to not fast. And in a lot of cases, it is about feeling that missing out, and the social communal aspect is really, really fun to engage in. So some special consideration on seeking medical advice. I think after we establish that safe space, if patients are able to voice their actual concerns and what they feel about Ramadan and their medical conditions. There are so many specific populations that would benefit from having a conversation with their providers. Some of the medical conditions that would benefit from a conversation are people with chronic illnesses. So thinking about diabetes management, hypertension, hypertension with anybody that have a strict diet, timed medication. So a lot of people would fall into that category. And from my world of OB-GYN, of course, pregnancy and breastfeeding is a population that would definitely benefit from a conversation as well. Anybody who is aiming to have a balanced diet or spacing their meals or goal of hydration would have. I actually just also chatted with a dietitian that just added to her counseling information to add how to change their diet around Ramadan and what patients can have a comprehensive diet still. So patients with chronic illnesses, patients who are watching for the diets, patients who have timed medications that are taken throughout the day. And I'd love to mention that we have a small yet vibrant Muslim community here in New Hampshire and Vermont. And I really want to give props to Chaplain Latif for making wonderful gatherings. Like I haven't even encountered, I've encountered a lot of them in the iftars that Dartmouth has been organizing this month.
So I'll tackle this less brief than my prior answer. I'll invoke a term that somebody I knew used to use. I don't know if you coined it, but the Ramadan warriors, right? And so akin to the weekend warriors who during the week are so busy with work and whatever it is, they can't exercise, and then they concentrate their exercises during the weekend and wind up injuring themselves, right? And so there's a similar analogy in that Ramadan has a significant fasting, even for a healthy person, can be a shock to the body, right? For a healthy person, let alone someone with a chronic illness. And so it's really encouraged, even Islamically, to fast intermittently throughout the year. Right, so there's specific days that are designated or encouraged to fast, to do volunteer fasts. It's encouraged, for example, to fast 3 days during the month, in the middle of the month. It's encouraged to fast if you want to do more every Monday or Thursday. It's encouraged to fast more leading up into Ramadan, so that when you actually start fasting in Ramadan, you're not using your time to acclimate your body to get used to the refraining, but you're spending more time on hopefully the reason why the patient is fasting in the first place, despite the detriment to their potential health. And so it's really important to encourage patients, number one, to do maybe a fasting trial, right? To see how they're going to handle the fasting during the month. You can maybe even do the trial if the fasting is in the longer daytime hours like we are in now. They can attempt to do this in the winter time, and this will give some information to the clinician on how to formulate a plan that's best suited to the patient, given the medical conditions. And if the clinician decides that it's not good for the patient to fast, having had these conversations beforehand will allow the patient to be more amenable, particularly if you come from a perspective of having knowledge of the month. So it's really important to encourage these good habits, right? So this is an opportune time to encourage to stop smoking, for example. Islam prohibits alcohol and drugs, and there are Muslims that will use alcohol and drugs. So this is a great time to have those kinds of conversations. It's a great time to have conversations about sleep hygiene. It's a great time to have conversation about meal planning and diet education, right? Avoiding salt and sugary foods and processed and oily foods, and to eat foods that are lower in glycemic index and increase in fiber, increase in protein. So both pre and post Ramadan conditions, not only is it an opportune time to address these issues for the month itself, to hopefully for the patients to fast safely, but it's an opportunity to take those habits post-Ramadan and encourage the patients to maintain those good habits.
Thank you both for those answers. Fasting is difficult, but it's not supposed to be an undue burden. So there are many exemptions. It's about mercy at the end of the day and connection. So not always easy, but it should not be in a situation where it puts someone at undue risk. And I thank you both for addressing that and for giving tips on how someone can prepare themselves for the month. I'd like to turn it over, well, I'd like to mention that there are in the chat several links that our esteemed colleagues, Jerome, Feroz, Jay, and Myra are providing. And also to turn it over to Dr. McBride for the next question.
Thank you, Chaplain Latif. I want to start and sort of bring Fatima and Seth into the conversation. And this only further establishes that the Geisel School of Medicine has a bright future, because the two of you are definitely a light that shines at the Geisel School of Medicine. So if you would, share with us, how do you recognize someone is actually fasting? And we'll start with Fatima first.
Perfect. I can start this off. And I think this is a really important question because without recognizing who is fasting, none of what we've learned today can really be applied. And the short answer is that you have to ask. You cannot assume that somebody is fasting. Islam, and this was previously mentioned, but I'd like to reiterate that Islam is the world's second largest religion with almost 2 billion people across all 7 continents. So that means that Muslims belong to every race, culture, and ethnicity. There's no such thing as looking Muslim. And so the only way to know is to ask. And that being said, you know, we have also been learning today that we can't assume that all Muslims are fasting. There's a number of exemptions or personal choices that people make that may exclude them from fasting during the month of Ramadan. And so truly the only way to know if somebody is fasting is to ask them if they're fasting. I think being aware that it is the month of Ramadan and asking your patient who is Muslim if they are fasting, you know, whether you elicit a yes or no response, I think it helps build rapport because it shows that patient that you do care about them and you are aware of what's going on in their lives as somebody who is Muslim. And whether they're fasting or not, I think they would appreciate that. And so lastly, as Dr. Al Ibrahim mentioned, there's a number of exemptions from fasting, and those include pregnancy status, menstruation, disease, young or old age. And so generally, I just want to reiterate that the uniting factor of these exclusion criteria is that if it is unhealthy for somebody to fast, if it's going to put them at undue risk, then they are religiously exempt from fasting.
Yeah, I would echo what Fatima said, that asking is probably the best way to understand if someone is fasting or not. Not all Muslims will fast, just like she said, and some will fast all 28 or 29 days, depending on the length of the month that particular year. Some will fast for as many days of that as they can. So not every Muslim who fasts will be fasting on every single day. Some definitely strive to fast every single day of that month, and many strive to that. But unfortunately, a lot of people are only able to fast for a handful of those days for various reasons. I would definitely echo what she said, that there is no such thing as someone who looks Muslim. There's no stereotypical Muslim. People who are Muslim look all different ways. They come from completely different backgrounds, speak different languages. I think in this country, there's kind of a stereotypical association of Muslims being either South Asian or Middle Eastern, but there are so many Muslims who really don't have any sort of a connection to a foreign country in any way. Most people don't realize, but 1/5 of the US Muslim population is Black. And there are tons of converts of all types of races who live in the US. So I think it's really important to just recognize, like she said, that that it is Ramadan, or that Ramadan is on the horizon in the months preceding. And maybe in your practice, implement something to the effect of maybe a question on a waiting room checklist or something that asks are you fasting for Ramadan? or simply posting signage in your practice or wherever it is that you work that encourages patients to speak up about it if it's going to be something that they're planning on participating in.
Thank you so much for that insight, very informative, and I'm sure our audience can appreciate the information that you provided. But I want to jump back right in, and for those that are just now joining us for today's Conversations That Matter episode, we are discussing caring for Muslim patients during Ramadan with our esteemed panelists. If you would like to take part in today's conversation, all you have to do is simply put your question in the Q&A section at the bottom of your screen, and we will do our best to get you some answers. Chaplain Lateef, I know you had another question for our clinicians on this panel. How about you just jump in and ask the question?
I could ask all day, but we only have a limited amount of time. For our clinicians, doctors Al Ibrahim and Ahmed, are there important considerations to be mindful of when caring for specific patient cohorts or medical conditions?
Thanks, Chaplain Lateef. I would love to add to the special population that we care in the specialty of OBGYN. Like we mentioned, pregnancy, patients who are pregnant or are breastfeeding are exempt if they feel like it's affecting their health. But a lot of patients would still choose to fast. The AJOG, which is the American Journal of Obstetrics and Gynecology, recently published an article that touches on some consideration on counseling patients who are fasting during Ramadan. It's a study that was based off of Harvard, and they came up with really simple to read and simple to go through consideration. And in their paper, they mention the limitations of a lot of the papers that are actually available to counsel our patients are some limitations in size, limitation on what the definition of fasting while pregnant are. But even with these limitations, they were able to come up with a collection of conclusions that I think are helpful in our practice. The study showed that fasting during pregnancy has no effect on neonatal birth weight. It likely has no clinically significant effect on preterm birth. Conclusions were indeterminate regarding its effect on the mode of delivery. And also the fatigue and dehydration had minimal decrease in weight gain. But those were the effects, the maternal health and symptoms. And also it showed that it likely had no effect on fetal heart rate tracing overall. And it showed that some possible negative long-term outcomes in terms of cognitive and long-term offspring effects. But again, they allude to the limitation of the available studies. And again, it reinforces the fact that we need to focus our studies in all populations and all needs, including the needs of Muslim patients. So overall, we need to be comfortable in addressing this in the general population and also in special populations like population in OBGYN. And the summary basically is there are no evidence-based studies that show any definite negative effects. But of course, it will depend on each patient presentation and their comorbidities. But they also provided a very shortened and more visual patient-based little pamphlets that I think would be beneficial for us to have in the clinic for patients to see, and also to help us and to provide visual guidance for our patients that I intend to share in our OBGYN clinic. And we'll add the link for their study as a reference for people joining today.
So I'll address two aspects of it. The first one quickly, there's a lack of data and studies on pre-Ramadan consultations. Despite that, it's probably important to get a complete social history from the patient, particularly if they've fasted before, or if they've been able to complete the fast before the entire month, and offer alternatives in a context of consultation with potential religious authority that will allow a concession to forego fasting, even if it's for part of the month, to either make it up at another time, or to or other concessions. And so it's important to ask how they've handled fasting previously, although they're not, as I mentioned, any that I came across studies or data regarding benefits of pre-Ramadan consultation. There are some condition-specific data that's emerging, but there's definitely a lack of a lot of condition-specific data, and a lot of work needs to be done from that perspective. Diabetes is talked about, well written. There are guidelines and recommendations written about diabetes. Cardiac patients, there is literature about that, some on epilepsy, some on kidney disease as well. But there's a lot of anecdotal, not a lot, but there's some anecdotal literature, but nothing that with any studies with literature otherwise. Medications are important to consider. You may or may not need to adjust medications. So that's just a side note. But as far as diabetes goes, given that there's a lot of literature in diabetes, and diabetes happens to be rampant in a lot of Muslim populations, hydration is important. Making meal plans is important because, as I mentioned, you have long days in the summer and even the spring. There's a limited time amount when we can eat and drink. And so we have to counsel patients to not feast after their fast, right? Is to break up their meals into small meals over longer periods of time. Another challenge is that because the days are long currently, and in the summertime, sleeping patterns change, right? And so a patient may take a big meal during the night and not wake up and take a morning meal, for example, right? And so glucose levels in diabetics are a huge concern, right? Hypoglycemia, both hypoglycemia and hyperglycemia, DKA and hyperosmolar hyperglycemic states are concerns, even thrombotic states as well. Cardiac patients, again, there's some data emerging, but not a lot written. Some patients that shouldn't be fasting, right, are patients who have unstable angina, for example, right? Or patients who have decompensated heart failure, patients who have uncontrolled hypertension, or are not compliant with medications, for example, right? So those patients probably shouldn't be fasting, and you should advise them not to. Renal disease, there's not too much that I found. Patients with GI disease, peptic ulcer disease that's active, or inflammatory bowel disease that's active, these patients may have a really trouble, or it may be detrimental for them to fast. So it's important to counsel them. As I mentioned, sleep patterns are altered, circadian rhythms are altered, REM sleep cycles are altered, right? And so any conditions that can be exacerbated by alterations of these REM cycles or these circadian rhythms, they need to be counseled specifically. Migraines, epilepsy, patients with eating disorders also are a patient cohort that need to be specifically thought about. And something that you may not think about, pediatric patients, right? I mean, the mandate for fasting begins at the age of puberty, right? It's not uncommon for 11, 12, 13-year-old to be fasting. And so you may need to write a note, for example, to excuse them from physical education class, for example, right? And it's not unheard of for even younger kids to see their parents fasting and want to participate and fast for part of a day, for example, right? So, and then I already mentioned or alluded to at least the psychosocial aspect of being part of a community and feeling left out, and maybe a patient may not go to the Islamic center or the iftar that we may have, for example, because they may feel bad if they didn't fast, thinking that this food is for the people who are fasting. I don't deserve this. I shouldn't go, right? And so we need to break some of these stereotypes as well. So these are just some considerations, absolutely not all-inclusive, but food for thought. Thank you. Iftar, by the way, meaning the evening meal when we break our fast.
Thank you both for those very real and insightful answers. These are people's lives and realities, and people have very strong feelings about when they're fasting, when they're not fasting. Even knowing that something is allowable can still be hard for people. With that, I want to turn over to Dr. McBride to ask a question about patient compliance.
Thank you, Chaplain Lateef. And it's even more relevant because we just got a question about this very thing. So how is the divine in order today? And so Seth and Dr. El Ibrahim, I want to just have this question to both of you because it just came in. How does a clinician handle a situation where a patient insists on fasting despite medical advice not to?
So I think the first place to start would be respecting the patient's right to autonomy, kind of leaning on one of those 4 pillars of medical ethics. So as we all know, every patient has like the right to kind of choose for themselves what they would like to be involved in their medical care. So if a patient really wants to fast, obviously we can't force them to take medication or to not fast if they really would like to. I think the best thing to do would be to kind of adjust their treatment plan and optimize it around their fast. Like, for example, maybe giving medication at the nighttime, if that's possible at all. Just making sure that their diet is lined up well with their medical goals. And for a patient who's like very, very sick, like for someone who, like Dr. Ahmed had mentioned, has like decompensated heart failure and really, really should not be fasting, you could consider asking them if they would like to speak with like an imam, which is a Muslim priest, to kind of understand better what it is exactly that they need out of fasting. Maybe just having a conversation with someone who has a lot of knowledge about Islam and about the requirements for fasting and can help the patient understand kind of the benefits from a spiritual perspective of fasting versus the costs from a physical perspective. It could be very useful to have someone like that on board as well.
Thank you, Saif. I would agree. I think the big concept to keep in mind is to handle the situation like any other patient encounter where a patient is hesitant to follow the recommendation or have their own reasons not to. Be non-judgmental, listen to what they're coming from, where they're coming from, and why they're saying it. And, you know, like we said, we have an obligation to provide full-on pros and cons of why we're providing this or why we are recommending this specific medical treatment and why we would recommend not fasting. And if they would insist on fasting, on not fasting, we should still be on their team and provide them on ways on how to best adjust their medication plan. And you brought a really excellent point, Seth, is to really tap into the reasons why a patient would love to continue to do that. And in a lot of cases, like Dr. Ahmed mentioned, it really goes down to the psychosocial aspect of feeling left out, being part of the community. The Holy Month is just a really special time of the year for the community to get together. And if we can tap on these areas, and we can also like have these conversations in our community as Muslim, you know, to destigmatize not fasting for a lot of different reasons, for physical health and mental health, and also for like all the reasons that we talked about as well, like pregnancy, breastfeeding, menstruation as well. So really, I think the big takeaway from this is to be non-judgmental, work with your patient as a team, and see what ways we can provide to adjust their plan as possible. And if it's strict and non-adjustable, we would still share with them our honest opinion of how this cannot be adjusted, but still empathize with them, their desire to fast. And I just wanted to mention one last thing is that the American Academy for Family Physicians provided really beautiful references. Like, I know this is not a medical recommendation talk, but they have really lined out a lot of different counseling strategies for our chronic condition patients.
Thank you, you both, but also we would like to get that reference for our audience. And I think they could benefit from that as well. Chaplain Lateef, I know you had one more question about fasting before we see if our audience wants to jump into conversations that matter.
Before we do that, can I just briefly add one thing to the previous question? And that's that, as was already beautifully said, assuming capacity, patients have the autonomy to make their own medical decisions. And so I think when a patient does decide to fast despite medical advice not to, I think we should feel empowered to perhaps suggest alternatives to fasting. And so if I may, and this is also listed in one of the resources we've provided in the chat, but the compromises we can suggest are non-consecutive fasts. So taking days off between fasts. Another suggestion is half-day fast. So people still feel included. They're fasting half of the day rather than the full day. And lastly, you can suggest makeup days later in the month or later in the year, excuse me, such as when it might be easier to fast. So if Ramadan happens to be during the summer, you can suggest that they make up their fasts in the winter when it might be a little bit easier. The days are a little shorter. It's not as hot outside. And lastly, it is Islamically permissible to, rather than fast, provide money for charity. And so to reiterate, the 4 alternatives to fasting are non-consecutive fasts, half-day fasts, making up fasts later in the year when it might be easier, and then paying charity. Sorry, I just wanted to get that off my chest. So more than happy to mute myself now.
Thank you for that very important addition. Islam, again, is supposed to be a religion of ease when it comes to this. Fasting is what is present during Ramadan, but again, it's not all that Ramadan is about. And Islam is an accessible religion. When someone cannot physically do something, when there's a danger for doing something, there are always alternatives. And the notion is that if you cannot fast, but you wanted to, you get the reward as if you did it. In fact, you get the reward for doing basically a perfect fast. So sometimes it's even greater. But I want to turn a final question over to Fatima, soon to be Dr. Haider, and Dr. Ahmed. What are some pitfalls to be aware of when caring for fasting patients during Ramadan? Can all fasting patients be treated the same?
I love that question because it's a leading question and it makes my life easy. So the answer is no, not all fasting patients can be treated the same. And I'll keep it brief because I do want to leave time for the audience's questions. But like any of our patients, Muslim patients and fasting patients cannot be treated as a monolith. So unique histories and medical conditions aside, everyone has different tolerances to fasting. And I think Dr. El-Ibrahim really beautifully touched on this earlier, that a lot of the suggestions we may make as clinicians should, I think, be rooted in the social determinants of health and the psychosocial aspects of this month. And so I think it's especially important for fasting patients to inquire about their social determinants of health. Just some questions like, where are they obtaining their food? Is there any food insecurity? How are they sleeping? What is their new medication schedule? These kinds of things that are really important to the changes that happen during this month that we've been discussing for the past hour. And so, yeah, I would keep it brief and just say that.
I'll keep it relatively brief in the waning moments. And if there's a pressing, we'd love to answer questions. So please feel free to interrupt me if there's an audience question. But the first thing I'd like to say is, well, let me back up a little bit. Just as it's important to ask the question on whether patients are fasting, it's also important to keep in mind that you don't want to ask a patient if they're observing Ramadan for someone who may quote unquote look like they're fasting but they're not Muslim, right? If you understand what I'm saying. And so maybe a general question about do you have any dietary, religious or cultural or specific dietary restrictions that you're following, is a more apropos question rather than asking if someone's in Ramadan. A lot of people who are not Muslim may get mistaken for being Muslim, and it's kind of a reverse kind of effect of assuming someone is Muslim. As was mentioned, Muslims don't have a face or a skin complexion or a garb, et cetera, et cetera. The second thing is, for clinicians, we need to set aside any implicit biases we may have, and well, first of all, to be able to recognize them, and second of all, to set them aside, right? No matter how unreasonable, how scientific you may feel that your recommendations are, and how unreasonable you may personally feel that this patient is not heeding medical advice to their own detriment. I hopefully in the beginning of the talk, I had set a picture for to allow us as clinicians to be more empathetic and understanding, and that was the purpose of that. And it's important to have a shared decision-making plan of care between both you and the patient, right? So that's extremely important. The second thing is, just to go on with Fatima also mentioned, there's you may encounter patients. If you treated one Muslim patient, doesn't mean that you can have the same plan for the next one, right? There's differences in beliefs. There's differences in even juristic opinion. So generally speaking, non-oral medications are permissible, for example, right? So IM injections, inhalers, right? Ear drops and nose drops. Even sublingual medications are permissible, but you may find some juristic opinions that differ from that, right? And so if you have a patient that follows those juristic opinions, then the care of the patient needs to be tailored to that. Some other considerations I think I already mentioned already, but I'll reiterate them. There's abnormal sleep patterns, right, and abnormal eating habits. So those need to be taken into consideration. And when the month is over, then the Eid celebration starts, and that's a day that actually religiously we're not permitted to fast, right? We're encouraged to eat and drink in moderation, of course, but we don't want to. We want to encourage the fasting to not turn into feasting, right? So Eid hyperglycemia, quote unquote, it can be a concern, right? Especially because people indulge in sweets, and sweets are often shared. So that's a significant consideration, particularly for diabetics. And education, right? Recognize acute complications of breaking the fast. Seek specialist advice, right? So if there's a situation beyond your expertise, it's difficult to even if it's a religious mandate, difficult to recognize that we may be limited. So we need to understand our limitations, whether it's medical/scientific, or recognize our limitations that we don't understand this patient. Maybe we need to consult a religious scholar, as I think Steph mentioned, I believe. And I'll leave it at that.
Thank you so much. And we have been really enjoying this conversation as we discussed today, caring for Muslim patients during Ramadan. And you've been a great panel and an esteemed panelist, because you've answered a lot of the questions. But we did get a question that came in from the audience. And that question is, how might institutions like Dartmouth College and Dartmouth Health support, as it was quoted, Muslim brothers and sisters in the healthcare profession, and it relates to working hours during the time of Ramadan. And Fatima, I think you would be great to start this off. Thank you.
Yeah, of course. So I can speak a little bit more about the Dartmouth College accommodations and what that looks like for students. I think we've been working very closely with administrators over the past several years to try and improve the accommodations for Muslim students during Ramadan. So one of that is having access to foods on campus during hours that are outside of business hours, because that's when we're eating. We are eating between sunset and sunrise. And so many students who don't have access to food outside of the campus may struggle with food insecurity during this time. And so there are different on-campus locations where students can access food after hours that allow them to practice fasting and to be able to do so in a healthy way. I think for medical students, we've been advocating a lot for specific accommodations during Ramadan. And that may involve things like changes in exam schedules or increased time for assignments. Really an acknowledgement that they are putting their bodies at increased stress during this month and that they may need extra support when compared to our students who aren't fasting. And so I think that that would be my perspective from the Dartmouth College side of things.
How about from the Dartmouth Health, Dr. Abraham? What do you think? As a resident, as a first-year resident?
I am very fortunate. First of all, I want to give a shout out to my fellow OBGYN residents as they're tuning in to this talk. My chiefs, both of my chiefs actually reached out to me and said, and my program director actually, if there anything to be done. And I personally, I think a lot of people would have different thoughts. I personally didn't think that I needed any accommodations. My only request was like if we're working like 24-hour shifts or in clinical work during iftar, like during sunset time or pre-dawn meal, is for me to take a quick break to eat something during that time. That was my consideration, which they were very understanding for. I think something to advocate for in general is it would be great to have a dedicated prayer space for on the resident side, which is a whole another discussion for another time. But we're doing a lot of work to have a welcoming and more inclusive space for the Muslim clinicians. I don't know how you feel about that, Dr. Ahmed, from the attending side.
Thank you. Beautifully articulated by both Fatma and Dr. Al-Ibrahim. But my anecdote in the beginning, I think, was a bit representative. Ramadan, fasting, and other considerations, but fasting is universal. Throughout history, fasting has been a practice culturally, religiously, etc. I don't know if any fasting practice is this prolonged and concentrated in this specific amount of time. And so to acknowledge and recognize, and as I mentioned, just to know that it exists is absolutely important. Of course, not to the exclusion of anybody else or any other individual or groups who also need to be accommodated. So it's extremely important. It boosts patient morale. Again, clinically, it provides a reminder that patients are coming in, and it just fosters a culture of caring to be able to practice your beliefs in safe environments that's been mentioned. And progress has been being made. This is obviously an amazing step that's been taken. So work is being done, but a lot of work still needs to be done. And all of you are doing an amazing job, by the way.
Thank you so much. And I know we're coming to the closing of our conversation today. And I know that Chaplain Lateef and I would like to thank our amazing panelists here today for joining the Conversations That Matter speaking series. We'd like to thank you, our audience, for joining and leaning into this important conversation. It was needed. And I know that the Geisel School of Medicine and Dartmouth Health will continue to have these critical conversations, and not only this series, but throughout our various offices on both campuses. And so, Chaplain Lateef, there is a special, I hear, dinner coming up on April the 19th. Could you leave the audience with that information?
Absolutely. Once again, thank you to all our panelists and all the attendees for a fantastic and powerful conversation. Ramadan is a time, again, of discipline, connection, very hard spiritual work. There's also a time for joy, and a lot of that joy is in the breaking the fast meal. So the Dartmouth Office of Diversity, Inclusion, and Belonging, Dartmouth Health Office, a lot of different groups are coming together to put together a wonderful iftar, break fast meal for the DHMC community, which our Muslim neighbors and friends and non-Muslims, everyone is invited to. It will be on April 19th in Auditorium C and D in the DHMC campus from 6:30 to 9:30 p.m. And we really hope folks can make it and share in that joy. Thank you.
Thank you. Thank you. We know that inclusion, you're right, impacts our well-being. And so that's why this series was created. It's designed to create inclusive workplaces that are built for the future. And we believe that today we have begun and launched our Conversations That Matter in a great way. This episode weaved together storytelling and research-driven conversations with our esteemed panelists. So with that being said, be brave enough to have conversations that matter. Stay well to you all.
And thank you, Dr. McBride, for organizing this. Looking forward to more conversations.
Thank you.